Step 4. Prioritize failure modes. The goal of the prioritization effort is to identify those failure modes most in need of further analysis to improve processes and reduce the risk of harm. In other words, prioritization helps identify those risks that most exceed acceptable limits. Once a team prioritizes failure modes, it is in a better position to identify which ones are most important to analyze further and address through redesign. Determine severity. Severity relates to the seriousness of injury or impact that could ultimately result if an effect of a failure mode occurs. In rating severity, team members should look at the effect of the failure mode, not at the failure mode itself. How do failure mode and effects analysis teams judge how severe a consequence of an effect might be? The process is a subjective one that involves use of judgment, intuition, and at times imagination. If the effect has been experienced before within the healthcare setting or other similar settings, a team may be familiar with its severity and the rating may not be difficult to determine. If the effect has not occurred within the organization, professional judgment and imagination may be required to determine severity rating. Determine probability of occurrence. Probability of occurrence is a likelihood that something will happen. The key question the team asks at this point is what is the likelihood that this failure mode or effect will occur? The team might want to frame the answer to that question in terms of mathematical ratios. For example, there is a low probability of 1 in 100,000 chances that something could occur versus a high probability of 1 in 10 chance that it could occur. An instance of remote failure is a vial of a medication from a pharmaceutical manufacturer containing a different drug than the label says it does. A more probable failure mode is that a prescription arrives in the pharmacy with illegible handwriting. Now let FMEA teams determine the probability of occurrence of both failure modes and effects. Determine detectability. Detectability is the degree to which something can be discovered and noticed. The key question that the FMEA team asks is, if this failure mode occurs, how likely is it to be detected? A high rating indicates that the failure would not be noticed, thereby placing the individual receiving care at a risk of experiencing the effect of the failure because no corrective action to protect the individual is likely to occur. A low rating indicates that the failure is certain to be noticed or is highly likely to be noticed, thereby decreasing the likely risk to the care recipients. How tightly processes are coupled inversely related to the detectability of failure modes. failure occurring in tightly coupled processes whose steps flow one another in rapid sequence are less likely to be detected than failures occurring in loosely coupled processes, which provide an opportunity to detect failures and permit intervention to correct the problems and protect from harm. To determine the detectability of a failure mode, an FMEN team asks, what are the current controls or barriers to this failure mode, and what is the opportunity to intervene if the barrier detects the failure. Calculate quality is to calculate the risk priority number, RPN, also called criticality index, based on severity, occurrence, and detection ratings. A team can choose to calculate an RPN for a failure mode as a whole. Failure modes with high RPN automatically warrant attention. A team can also choose to calculate an RPN for each effect and then add the RPN for each effect together to get an overall criticality value for the failure mode. This is the most rigorous approach to quantifying risk because it considers each possible effect of each failure mode. This level of detail is presented here to demonstrate the factors that might be considered. Failure mode 1 has two potential effects whose RPN are 126 and 196. Adding this, failure mode 1 has a critically value of 322. Failure mode 3, which has the most severe potential effect, 1 with a rating of 10. And another possible effect has a criticality value of 195. The criticality values are used to establish a priority ranking for further analysis of failure modes. Step 5. Identify root cause of failure modes. Before failure mode and effect analysis, teams can identify improvement actions to eliminate or reduce potential failure. They must identify and understand the root causes of the prioritized potential failure modes. Root causes are the most fundamental reasons a problem could occur. Most root causes in and of themselves are not sufficient to cause a failure. Rather, the combination of root causes sets the stage for potential failure. There are several characteristics of an effective RCA, including the following: focuses primarily on systems and processes, not on individual performance. Progresses from special causes in clinical processes to common causes in organization processes. Repeatedly dig deeper by asking why, then when answered, ask as why again, and so on. Identifies changes that could be made in systems and processes, either through redesign or development of new systems and processes that would reduce the likelihood of failure modes occurring is thorough and credible. Root causes of a failure mode in healthcare can be categorized according to the important organization functions or processes that the organization performs. This can include processes for the following: leadership, embracing the culture of safety, supporting performance and quality improvement, and the clear communication of priorities, human resources, information management, environmental and equipment management. Step 6, redesign the process. To redesign process effectively to prevent harm, FMEA teams need to directly address characteristics of high-risk processes. The goal is to reduce an aspect of the process that elevates its risk. Redesign approaches should directly address the following: decreasing variability, standardizing a process, simplifying process, optimizing redundancy using technology to automate, creating fail-safe designs, documentation, reducing coupling, providing comprehensive education, establishing a culture of teamwork. Decreasing variability, although healthcare organizations do not have a lot of control over variability of the care recipients. There are strategies that address this risk factor. One strategy involves developing and implementing criteria for the selection of appropriate candidates for elective procedures. Other strategies are to develop and implement pre-treatment preparation for high-risk care recipients, manage comorbidity, and manage level of care. For example, intensive care units versus regular medical surgical units to risk status. Standardizing processes. Standardization can reduce the variability of process implementation and the unneeded variety of factors that can lead to failures. In other words, standardizing a process can make it easier for people to do the right thing and harder for them to make mistakes. Standardizing drug doses and administration times and limiting unneeded variety in drugs. Equipment supplies rules and processes of work is a means to reduce errors and potential failures. The failure mode and effects analysis team has identified elements of the process that merit redesign in order to reduce the risk of a failure that would or could harm someone or to mitigate the effect of an error that does reach someone. A team has evaluated and prioritized redesign elements. At this point, the team is ready to consider how to put the process redesign in place. When testing a new process or sub-process, several strategies can ensure the highest likelihood of success. Conducting a paper test, FMEA, simulation, and pilot testing. Each of these strategies must involve input from a multidisciplinary team that has a clear understanding of the problematic process and the proposed redesign one. Paper testing. The first strategy the team might use may be to analyze the redesign process on paper. FMEA again provides an approach for doing this. laboratory analysis and other analytical techniques can also be used to test the design process on paper. Simulation. A team may be able to use simulation to test a new design within a risk-free environment. Simulation allows the organization to experience the implication of a redesign without risk to the individual receiving care. A paper stress test or computer-based simulation exercise can help a team anticipate the full range of decision-making and performance issues that might arise with a new process design. Pilot testing. If the paper tested or simulated process redesign looks promising, conduct a pilot test to determine the real-world effectiveness of the new process. Through pilot tests, a team implements a redesign on a small scale, monitors its results, and refines the redesign as necessary without taking the risks associated with full-scale implementation. This enables the team to ensure that the design is successful before committing significant resources to the redesign process. Once the process has been successfully tested, it is time to implement it on a large scale and actively manage the change process. Implementing the redesign process is all about introducing change into ongoing healthcare processes. The following actions are value mode and facts analysis team might take to help manage and lead the change process. The first action is to establish a sense of urgency about the needed design. This can be accomplished by identifying the best practice and the gap between the organization's process and the best practice process, identifying the consequence of being less than the best, and exploring sources of competency. The second action is to create a guiding coalition. This involves finding the right people to affect the change, creating trust within this group, and establishing a shared goal about the need for process redesign. The third action is to develop a vision and a strategy about the design process that is easily pictured, attractive, visible, clear, flexible, and communicable. The fourth action is to communicate the change design in a way that is simple, works in multiple forms, involves doing instead of telling, explains inconsistencies, and involves give and take. The FMEI team develops and implements plans that address how the design process will be communicated organization-wide, department by department, or discipline by discipline as appropriate. The fifth action is to empower a broad-based action by communicating a sensible vision to employees involved in the redesign process, making organization structures compatible with action, providing needed training, aligning information and human resources systems, and confronting supervisors who undercut the design changes. The sixth action is to generate short-term wins by fixing the deaths of certain components of the process redesign, doing the easy tasks first, and using measurement to confirm process change. The seventh action is to consolidate gains and produce more change by identifying true interdependencies and smooth inter-identifying linked subsequent cycles of change. As and the final action to anchor new approaches in the culture with results, a conversation, turnover, and succession. Five key elements to successful FMEA: leadership support. As mentioned earlier, leaders must be committed to the FMEA process as a proactive risk assessment. Leadership's guidance in the importance of FMEA through providing the necessary resources, responding to findings, and encouraging the regular use of FMEA will help staff to view the process are not just extra work required by regulatory organizations. Resources-led leadership must allot include the required people, time, materials, support, such as data analysis and money. Focus on and commitment to safety. This ensures the identification and improvement of processes that could present safety risk to the individuals served by the organization. Processes that have greatest potential to cause harm should be the primary focus for risk assessment, sustain, and strategic performance improvement. Leaders must establish and maintain an environment that values performance improvement and use FMEA results to help direct continuous and future improvement efforts. FMEA must be an integral part of an overall quality management process or plan. Properly conducted FMEA will be confirmed by the measurement system. Effective information management. The organization must be committed to obtaining, managing, and using information to improve outcomes. Effective FMEA depends on reliable and available data about the performance of processes and FMEA results. Data must be uniform, timely, and accurate, and the procedures and processes must be well documented to reduce unnecessary variation. Well-trained and qualified personnel. FMEA teams include individuals who are trained in the use of FMEA and other performance improvement techniques and tools, and who are knowledgeable about the processes under study. The essential ingredient for the team's success with each of these activities is leadership support. Leaders must provide the support need to bring change in the form of the process redesign directly at reducing harm to individuals. They must set a tone for a culture that supports safety and pursues a preventive approach to failure reduction. The culture must be a non-punitive one. Designing and redesigning for safety means making it difficult for humans to err. However, leaders must recognize that failures will occur, and that recovery or correction should be built into healthcare processes so that individuals can take corrective action and thereby prevent harm. Okay, wish you have a good time. See you next time.